Welcome everyone to the first edition of Health Corner, sponsored by Essex County Council. My name is Dr. Ukpaka. I'm a GP in Basildon. We have today a specialist physiotherapist who will speak to us about back pain. Back pain is a common problem in our communities, and not many people understand this problem, but we have the specialists who will give us an insight into this problem and will be able to advise us on what we can do on ourselves, by ourselves, with our families, at home, around this problem. We can do something about it. I know that we have the doctors, we have the system where we can go to for support, but on our own, there are still things we can do to take better care of our health. So I wish to introduce Mr. Shyam Chatty, the specialist physiotherapy. Mr. Chatty, you're welcome.
Thank you, doctor.
So now I'm going to hand over to Mr. Shyam Chatty. Welcome to Health Corner, and we would like to hear you talk about back pain.
Thank you, doctor. I appreciate the opportunity. It's a big topic, and I wanted to make sure in the next few minutes I will help the audience to understand some aspects of low back pain that are very fundamental, but that will help them to understand the whole how the back pain happens and what they can do about this. So by the end of the program, I'm hoping to achieve this pretty well. So going back to if you look at the low back pain, we have to understand the evolutionary perspective, first of all. When I say evolutionary perspective, I'm talking about the change from quadruped animals to bipedal human beings, where we became upright into erect posture as a human beings. It has got advantages and it has got disadvantages as well. So the advantages, of course you'll agree with me, it enables us to use the hands like no other animals can do. And it will also enables us to use the eyes to see further from the ground. So that definitely added to the advantage of survival for us, because that's why we sit at the top of the animal kingdom. So if you look at the disadvantages of this conversion from four-legged animals to two-legged human beings, so with the advantages, we have got difficulty with respiration, and the transport of the blood to the brain is also another issue, and also the back taking excessive strain, and that is what we will be talking about it today.
Yeah.
So when you look at the pain as such, the pain is a subjective experience that is real and that is expressed by the patient, and it has got an emotional component as well. Sometimes we, as medical professionals, we need to take that into consideration. Pain is not just a sensation, but there is an emotional component attached to it. When we say low back ache, the term low back ache refers to the pain in the lumbosacral area. So what this means is the area where the rib cage ends and the area where the pelvis starts, that segment of the lower back, which has got 5 individual bones, we refer as vertebra. And this is the 5 segments. And even though it's a 5 segments, we refer to as low back pain. Predominantly, it's the lower part of the lower back, which is the 4th and the 5th, the bones of your lower back, and that is where maximum strain is usually focused.
So this is the part of the body that carries the weight, all the weight. Is that right?
That's right, doctor. So now we refer this as HAT, which is head, arms and trunk. It's just a short form. So the weight of the head, arms and trunk is actually transmitted through these 33 segments, which is called a spinal column. Even though it's a 33 segments in the spinal column, the bottom 5 we refer to as low back. So because it's actually at the end of the spine and it takes the whole weight, and that makes the lower back more vulnerable and susceptible for injury, strain, and stresses.
Okay, so this is the part of the body or the part of the spine that takes all the weight, and this is the reason why we tend to have more pain in the lower back,
That's
the
right,
lower
Doctor.
5 bones.
That's right. So some known facts that we should know. About 60 to 80% have back pain. That sounds a huge percentage. And out of this 60 to 80% of the normal 100% population, and 30 to 70% have recurrent episodes of low back pain. It is not just once. So which means that once we have a strain or back is hurting, we have to definitely take care of that issue straight away so that it doesn't happen again and again and again. And it affects both genders, both men and women. Now there is a lot of research which talks about who gets more, but it all depends upon mainly with the lifestyle factors, their occupation, what job they do for day-to-day life, and how well they look after their muscles in terms of improving their strength and tone.
So for the benefit of our viewers, are we saying that it occurs the same in men and women equally, or are men more affected by low back pain than women?
Now, there is reasons why women will have more back pain at certain stages of their life. Let's say a simple example, when a woman carrying a baby, so that means that extends the abdominal cavity, and along with that there will be more movement of the spine. That makes them more susceptible at that stage. And also we all know that after a certain age, women have got osteoporosis, where the calcium concentration in the bones is less. So at that time they're also more prone for the low back pain.
Osteoporosis is it the one they call brittle bone?
That's right, Doctor. Yes, where the calcium levels in the bone will reduce with age, with certain stage in life.
So, what about ethnicity? Do people from certain cultures they more affected by back pain, or it doesn't matter where the person comes from?
No, it doesn't matter. As I told you before, it is the job that the person is involved. Of course, if somebody is doing heavy manual job, their job involves a lot of bending forward and lifting weights, like delivery drivers or people who work in warehouses. So they will have lots of stresses and strains happen to the low back, which means that they are more prone to get low back pain. So in other words, it is to do with ethnicity. It depends upon what they do for living, and that would contribute to the
And
low
you
back
did
pain.
mention people who are obese, who are fat, tend to suffer back pain more.
That's right,
because
Doctor.
the weight of their body is affecting the lower back.
Absolutely. So we can actually call this as a lifestyle factors.
Okay.
So the lifestyle factors, yes, that makes a huge difference what goes on the plate. And of course, we have to emphasize their mental well-being as well, and that also contributes a lot to the overall well-being. When we look at the back pain, it is just one segment. We say low back pain, but it is a part of the bigger picture. It is all about the well-being. If they have got good well-being, if they actually have got good lifestyle, they eat well, they exercise well, and they understand the stresses and strains that happens on a day-to-day life, we refer to as ergonomics. Ergonomics is the word that refers to how we carry ourselves and understand where the strains and how to minimize the strain happening in the low back pain.
So if people are big or obese, if they lose weight, that will help them to improve on the symptoms of the back pain. Is
Yes,
that right?
definitely, yes. So obesity is just carrying the weight. Of course, the people who are obese, they have to carry the body weight. Yes, that is right. And people who lost weight, and also it is very important for them to work on the strength and stamina of the muscles. When I say muscles, I'm talking about the trunk muscles that support the low back. And if these muscles are worked on or looked after in a right way to improve their strength and the stamina. When I say stamina, their ability to work over a period of time. And if somebody is taking care of that aspect, of course, the physiotherapist can help in a big way with this. Yes, losing the weight and also working on the right kind of exercises to strengthen the core abdominal muscles. So I'm saying core, I'm not talking about the muscle that gives six-pack appearance. I'm talking about the core itself, the muscles that lie very close to the spine. And these muscles are responsible for providing the stability function. If these muscles are strong and they're doing what they're supposed to do, then we have got good back and healthy back. If these muscles are weak and if they're not doing what they're supposed to do, and that is where you feel the low back is not working with us.
Okay, well, that is very good. I'm sure the audience are learning from what you're saying. That means that exercise will be very key to treating some of this low back pain. I mean, you are the specialist in this. It will be interesting to hear some of the exercises we think people should do to help with lower back pain.
Yes, doctor. We will cover that probably a little later in this episode. Yes, we will definitely talk about the simple, simple exercises that can be done by everybody. And of course, if there is any specific condition with the low back pain, and like you as a GP, you referred to the physiotherapist, and of course we can do individually look at the assessment and can help them as well.
Fantastic. Okay.
So now going back to the age where the pain actually happens the most. Usually the research says that low back pain occurs in people between the ages of 20 to 60 mainly. I'm not saying that it doesn't happen beyond that. I'm only saying this is an age where they're working and they're doing a lot of activity, and there are lots of stresses that are happening in the low back pain. This is a more vulnerable group, usually the age group. But the peak where the back pain peaks, the frequent occurrence of the back pain peaks at the age of 40. This is coming from a research study. So the most common cause of the back pain is soft tissue strain. Actually, this is coming from a research which is done in 2012. They've looked at all the possible factors that are contributing to the low back pain, and the research proves that the main cause, the common cause for the low back pain is the soft tissue strain. So that is what is causing it. And of course, frequent lifting while twisting and exposure to vibration is also proven to be a couple of other factors.
Right. So this is where driving.
That's right. That's right. People who have got driving, nowadays a lot of attention given to the kind of seats people sit in, and a lot of consideration in terms of making sure that the driving is as comfortable as possible, so that it helps the low back.
Fantastic. Yeah.
So now this low back pain, if you classify the reasons for this low back pain, we can classify into mechanical causes, where it is purely bending down, stresses and strains, or it could be inflammatory, where it is coming from an inflammatory condition like arthritis. So the reasons of the back pain, if you have to put them in a simple order, so one of the main things we've been talking about so far is mechanical low back pain, from mechanical causes. It could be inflammatory, coming from arthritis. It could be metabolic, coming from some metabolic conditions. Neoplastic, which is the cancerous growth. Congenital, which means that some people have got some defects with the bones right from the time they were born. So that is congenital. It could be infection, some kind of infection, like the common infection is tuberculosis in the spine. And sometimes it's psychogenic as well. Some people have got mental health issues and they will have some low back pain, the body-mind relationship.
Even when there's nothing wrong with them physically, they still get back pain.
They can still feel the pain.
No, that's possible.
Or sometimes it can also radiate from the visceral organs. We refer to as a referred pain. It's not actual pain in the back, but it comes from the visceral organ. Like kidneys have got, some people have kidney stones. They can feel the back pain. Somebody has got women have health issues, and they could actually have got the referred pain to the low back.
So things like water infection is very common among the elderly across the board. Can that cause back pain?
There is no evidence as such. I didn't come across any evidence as such, but we know that there is an evidence to say water infection makes elderly prone for falls.
Right.
And when they fall and they will jar and they could get back pain, but this is secondary to actual cause.
Oh, okay. So they are not really the real cause, but they can.
That's right.
Okay.
And the other risk factors, quickly, job dissatisfaction can actually cause the low back pain. Depression, this is something very important. Obesity, as Doctor mentioned a little bit earlier. Smoking also predisposes somebody to low back pain.
So talking about smoking, are we talking about cigarettes or cannabis or sushi? You know, some people chew tobacco. Is that part of smoking?
Now, if you look at the better end of the smoking spectrum, which is the smoking with tobacco, so it really doesn't matter. We are talking about the blood vessels, the tiniest blood vessels, where these carbon particles will go and block, which means that this vertebra doesn't get the blood circulation. When they don't get blood circulation, then it makes the back will not be at ease.
Right.
When the back is not at ease, we simply call it as low back pain.
Right. So people should really stop smoking.
It would be
because that could cause.
It could be a good idea.
A lot of more problems
for different reasons, from economical reasons, and of course it will for lungs definitely, because there is more chances for them getting lung cancer.
A lot of people think smoking is just the lungs, but actually it can cause back pain
as well. Yes. And alcoholism is also proven to be one of the risk factors for somebody to get back pain. And economical deprivation. If somebody is having not good lifestyle or not good life in terms of economical, how much of earning they are.
So are we saying that people from poorer communities suffer more back pain?
That's right, yes.
Right, because a lot of the poorer communities, I mean, we have the ethnic minorities who might fall into this group. So it's possible that some people might be, or some parts of Essex or Basildon may have people suffering more back pain than the others.
Yes, because when we say socioeconomic deprivation, we're talking about some communities whose they haven't really paid much attention on their learning and their education and schooling, which means that their understanding of what the back pain, how this actually works and how to look after the back, that will be generally less. And the programs like this would throw some light so that they could, people who are watching this program and they would understand these programs, look at it and learn from the conversations we are having, so that they will understand how to look after the back.
Fantastic. Yes, Mr. Chatty has gone through some of the causes of back pain. Like he said, back pain is a huge topic. But what we know is people who are fat or obese suffer a lot of back pain, because that puts a lot of strain on the lower back bones. And some of the lifestyle we live, the things we eat, and the job we do, even people who are not happy with their job may have more risk of suffering back pain. Now, we're going to end the first segment. In the second segment, Mr. Chatty is going to tell us what to do to help with this problem. Stay tuned, don't go away. We will soon be back. Thank you. Welcome back to the second segment of Health Corner. Today we're talking about back pain, and we are lucky and privileged to have Mr. Chatty here to do justice to this topic. In the first segment, he's told us about some of the causes of back pain, and he did mention clearly that being overweight and our lifestyle in general is one of the major causes of back pain. Now, in this segment, he's going to tell us some of the things we can do, especially centralizing on exercises. I know there are other things we can do, including medications, but this program is all about what we can do, self-care, and when to contact the specialist. Mr. Chatty, you mentioned obesity. You mentioned some of the things we do, like our job, that is responsible for people coming down with back pain, even where we live, the socioeconomic class. I remember you mentioned that. Can you tell us more about exercises? Because the audience will want to hear, is there anything they could do? And if it is, what?
Sure. Now, the main purpose of exercise, any exercise, is to improve the blood circulation so that the muscles are able to get stronger and support the joint, what it is around, what it is supporting. And that is no difference when it comes to low back pain. So the low back pain, there are specific muscles. Now, research is saying no matter what we are doing, whether I'm playing a game involving lower limbs like football, or I'm actually using upper limbs like a netball game or volleyball game, no matter, before even my arm muscles or leg muscles start working, the first muscle that will and that should get recruited is the core muscles. So if there is a delay with either the contraction of the core, or if sometimes people have got chronic low back pain, which means the low back pain more than 3 months, and for them sometimes the research says that the activation doesn't happen at all. So the purpose of the exercises is to improve the blood circulation so that the contraction of the core muscles happens at the right time that they should be.
So these core muscles, I know the audience might be wondering, where are they? Are they in the back or in...
Sure. So the core, the word means central. That's what the word means. So when I say core muscles, we are not talking about the muscle that gives six-pack appearance. We are talking about the muscles that lie very close to the spine, and those are the muscles which have the responsibility of supporting and stabilizing the muscles. So now, coming back to the question, you asked what exercises we could do. Now, these exercises can be classified into cardiovascular general exercises. So these exercises includes cycling. People who actually, dancing is a very good exercise. People don't realize how important and how useful dancing as an exercise.
And even when you're dancing, you're helping us to be happier.
Yes, that's right. And all the feel-good hormones and all the muscles which you would not use otherwise, because because with the music, and it's therapeutic, quite therapeutic. And swimming is one other thing which is really therapeutic, because when you swim, you have to breathe in a normal way, correct way, so that is a more therapeutic and more relaxing thing that somebody can do. Or people who can't do the cycling or dancing or swimming, they could just do the walking. Walking is very, very good. So when you say walking, I am aware that individual capability is different. So they need to start somewhere. So that somewhere is their baseline. So say, for example, if I wanted to find out what is my ability, I just walk, I time it, either time in terms of time or the distance, maybe from here to the local shop, and come back. And if I'm happy and my back is fine, which means that is my capability of my muscles. Once I know the baseline, then all we need to do is gradually work on increasing the baseline gradually. Usually we say 10% of increments. Let's say if I walked for 10 minutes today, tomorrow I could increase to 11 minutes and my back wouldn't mind much. That's fine. 10% increments, your body will accept it. That's fine, it won't reject it. But if I do 10 minutes one day and suddenly I do 20 minutes or 30 minutes the next day, and suddenly it's a huge gap, a huge leap, my muscles might not like it.
And the person could come down feeling pains or achy, and that will stop them even doing the exercise more.
Absolutely. I can understand, because if it is too painful, that can put you off from exercises. So when you are exercising, it is very important for us to understand what is the muscles I have, what they are happy about. And I need to understand that. And once I understand that, then it is easier for me to look at how to increase it, increment it gradually. It doesn't happen overnight. It has to be a gradual process. But with if this is gradual, and if you can see gradually my muscles are capable of supporting me for walking longer and longer. I'm saying just as a walking as an example, but I'm saying it could be anything. It could be swimming, or it could be cycling, it could be anything. But if I know what is my capability, then it is easier for me to look at how to increase it gradually.
And that is very important, because I mean, for people who are physically challenged or called disabled, but you know, you're saying people exercising within their capability. So if I have the older persons, it could be the African or the Indian or the Chinese, you know, I know they're not able to cycle, but they can walk, they can dance, and they can dance within their houses or their rooms, or you know, and that's a good exercise. That's what you're saying.
That's right. So some people who has got balance issues, if they can't walk outdoors, either just marching on the same spot while holding on to some support. If they are marching on the same spot, the same rules apply. They could hold on to the support, they can march, they can find out how many steps or how long they are able to march before they get tired. They understand that, and then once they understand that, then it is the picture is very clear.
Right. So for those people who easily get tired with exercises, we see that. So it's a good idea not to feel discouraged by that. They could be doing it in little increments.
Absolutely, doctor. You rightly, as you rightly said, it is the small increments, but it is important for them to understand where they are. It is quite easy for them to understand. Do they simple experiment themselves, or if they need some help, they could always seek some physio's help, or even the sport and exercise therapist who will be in the gyms, and they will be able to help you in understanding what is your limit, what your capability, and then once you know that, then either you could make that structurized program, or somebody can actually help if you can't do it yourself.
So I think listening to you, people can, as a family, they could do that in groups. As a family, take family walks.
Yes, that's right. Yes.
Yes.
Now, I know personally one of the families, they have got the Zoom where all the families will do the exercises together.
That is very good.
Yes, they do yoga.
Yes.
They have got the Zoom, and they join from across the globe, and they do yoga together, and that is very, very useful. And I also wanted to mention about the holistic sciences, which is yoga, Pilates, Tai Chi. These are holistic. This is not just about back, it is for the whole of the well-being, because it is taking into consideration of breathing, it is taking into consideration of the whole body as such. So we could also include, if somebody is capable, if they have got resources and opportunity to take up yoga or take up Pilates or take up Tai Chi. And that is proven to be quite effective in terms
and it
of
helps the
overall
mind as well. It's not just the back.
That's right. Yes.
Right.
So if you say this is too much, and what are the other ways somebody can help, can work? And there's a lot of research which talks about. I'm sure people have seen the inflatable gym balls, which is quite big and inflate, and they just have to sit on it instead of sitting on the sofa or the chair. If they sit on it, then they could just see how long they're able to sit, and then use that as a baseline measurement, and then work about 10% increments, and that will work really, really well.
Right.
Because the gym ball works really very well, because it's unstable, and that engages the core muscles I was talking about, the muscles that are close to the spine. They are engaged naturally, and once they're engaged, and then now we know whatever the time that a person is capable of sitting on the gym ball, they will understand how long the muscles are happy about.
So is the gym ball safe for the elderly?
Now, when you say gym ball, yes, there is an element of the gym ball running away. Yes, but usually when people use it in the corner of the wall, where they know for sure it's not going to go away anywhere, but still they have that element of instability of the surface, which naturally engages the core abdominal muscles. And that is something that people can do that, not only to improve the strength, but it also gives them a number to support with, that they are actually improving. And that is the best thing. Anybody who has got low back pain, they would like to see the results. And they can get the results themselves doing the simple things.
And talking about results, I know the families, the elderly ones, the younger ones, talking about results. How is the best way to, well, I would say quantify, the gauge? How is the best way to record exercises? Is it timing themselves, or is it, how is it that people can measure how much improvements they are making in order to either motivate them or to find out whether they're making any improvements?
So that's a good question. Now, if this is activity specific, so if I'm walking, then I could actually, because if I have to measure the distance, it's not practical. But I could actually have the watch, and then I can see how many minutes I'm actually walking, going one way, coming back one way. So when it is walking, we can actually easily take into the duration. If somebody is elderly, if they can only do marching on the same spot, holding on to the support, then they could just count the number of steps on each leg.
And a lot of questions we get from the audience, from the public. You talk about walking. How long, what is the recommended length of time to walk? Is it every day for 1 hour or half an hour? Or what is it? What would be your advice to people who like to walk, who would like to take up walking?
No, there is no a limit to this, and as I said before, it's individual specific. So they need to find out where the muscles are for them individually. So let's say if I am walking, I might be able to walk for only 10 minutes. That is my limit. And now I'm working on increasing that gradually. Or let's say you could walk for 30 minutes. So that is your limit. And then you could gradually work on increasing that. So whatever, I'm just saying as an example here, if this is about endurance, it's about stamina. If you have the stamina this much, you could use that stamina in any other activity.
Yes.
If I have to sit in front of the computer, if I'm capable of walking for 30 minutes or even sitting on the gym ball for 30 minutes, I know that my muscles are good for sit on the chair for 30 minutes. I could actually extend the 30 minutes to 60 minutes. But what is important, sometimes people lack, is they need perseverance. They need to stick to their plan. And then it's always good for them to write down their increments, not with an intention to show it to someone, but with an intention for them to look at it. It will be surprising how they've started 1 week ago. In a week's time, they would have doubled. That's
a good advice, yes.
So I would strongly recommend whatever the exercise you're doing, either in terms of the duration or number of steps or the distance or any parameter that you're comfortable with, it's always a good recommendation for you to write down, and you could see those numbers for yourself, and that would prove that you're definitely heading in the right direction.
Fantastic. I know you have some other photos and animations of exercises. So when it comes to the back, what is the best of all these animations? Because I can see our audience would see some of the pictures and movements. So is there any one for better than the other, or just what anybody can do, you advise them to do?
No, there is nothing better than the other, but sometimes we say cardiovascular, which works on the whole body, and like cycling, we spoke about dancing, swimming and walking, or jogging, running, whichever way. Or they could take up, if they're able, they could take up the holistic sciences, yoga, Pilates, Tai Chi. That's one aspect. Or they can actually take into working on the specific gym ball, sitting on it, or they could actually work on the core specific exercises, which if they're keen, then they can speak to the physiotherapist, and they will be able to put them on the right program that is appropriate for that particular individual.
And I think it's very important. If they are doing these exercises, someone has back pain and is doing these exercises, if they're not getting any better, if they're getting any worse, I think it will be time for them to consult a doctor or to speak to a physio.
That's right. So in the practice, what we do is sometimes we receive as a first contact physiotherapist as well, when we get a lot of referrals from the general practitioners, where our job is to reduce the workload for the GPs who are working really, really hard. So when we see the patients and we give them a specific exercises after thorough assessment, and then they will go back and they will do the exercises, and about 60-70% of the population whom we see, and they usually don't come back to either the doctor or the physio. But sometimes those 20-30% of the population, they've got ongoing issues that needs to be looked at a little bit more closely. Yes, for them, I would advise them to seek medical advice, speak to the GP in terms of pain management, or we have to look into the further options if the exercise doesn't work. Sometimes it doesn't work if the cause is a little bit more complex. Then we need to look at the whole issue holistically, not just one angle of exercise or physiotherapy. Then we should look at the bigger picture of holistic approach.
Yes. Okay. Yeah, thank you for that. There's one question that came through the last time. Someone was asking, is there any exercise that is not safe for a pregnant woman?
So now, when you say pregnant women, I'm sure there is a lot of strain on the lower back. So there is usually we call it as a trimester. Trimester is the first 3 months, second 3 months, and third 3 months. We call it as first trimester, second trimester, and third trimester. Because the baby is trying to establish in the first trimester, usually physical strenuous exercises are usually avoided. So now, second trimester is usually good for doing exercises like swimming, walking is very, very good. Third trimester, when the baby starts growing bigger and there is a lot of strain, and they need to do some core specific exercises. So again, core, I'm pointing out to the audience once again that the core is the muscles that lie very close to the spine, and there are very specific exercises, and that will be not only helpful for improving the strength of the lower back, but they will also helpful after the birth of the child. Then the mother will be able to recover much more quickly.
All right. Oh, that's good. So I know you are from the Asian continent, and from your experience, is there any exercise do you think people from certain cultures prefer to do? That, are there, from your experience anyway, are there cultural specific exercises that you will encourage people to do, or not at all? They should just do all the exercises across the board?
No, if you talk, because I come from India, my birth is in India. Usually yoga is well practiced back home. Lots of people do different kinds of yoga, whatever they're capable of, and there is some way of doing some kind of yoga that is specific to them. So yoga is it's a wonderful thing. Not only just physical benefits we're talking about, it has got mental benefits and lots of other things. And the way they look at the life would be slightly different, and they won't take it too seriously or take it too personally for these things, and they will get along with life much more easily. So I'm just talking from the cultural perspective. Yes, from people who are from India, they will be more inclined to practice yoga.
Right. I know you speak different languages. Just for our Asian audience, back pain is called what is it Hindi? How do you describe that?
Yes, I'm talking about in Hindi, which is the national language in India.
Oh, right, okay.
They say kamar mein darad.
Okay.
Kamar means low back.
Right.
Darad means pain.
Oh, right.
So they say kamar mein darad.
And then exercises. What is exercise in Hindi?
They call it as kasrat.
Oh, right. Okay.
Kasrat.
Yes.
I still remember
You still remember that, yes? You're very good. Yeah, no, but we've actually benefited from a lot of your knowledge. I must commend you for coming to Health Corner today. Mr. Shamshati, you are a specialist physiotherapist, the CEO of Wellspring Limited. The audience, I'm sure you've heard from the specialists. Back pain is caused by a lot of factors. A lot of them are down to us to correct as well. It's connected to the type of life we live. You add weight, you get you run the risk of getting back pain. But if you get back pain, it's treatable, but you can actually treat yourself by indulging on the right exercises. And Mr. Chatty has told us a lot about yoga, about dancing. You can stay in your room and dance yourself, dance to your favorite music. It trains the whole body. He's talked about swimming, which is a good form of exercise that trains the whole body as well. So there are other things we can do, but what he's saying is do not exercise beyond your capability. Do it within your limits, and then be increasing gradually, even if it's, and then did you say 10%?
10% usually is recommended.
Yes, recommended 10%. And I know some people think that walking for at least 30 minutes is recommended, but he's saying, the specialist is saying that start walking, but keep charting your performance and work towards increasing it gradually. And you find out that over a week, over a month, over 2 months, if you're consistently doing these exercises, you will improve your back health. The back pain is treatable, obviously. If you do the exercises and the back pain is getting worse, please don't continue, go and see your doctor. Mr. Chatty, it's a pleasure to listen to you today. You've really done very well, and I'm sure the audience have benefited from your wealth of knowledge. I know that there are other aspects of pain or musculoskeletal pain we're yet to talk about. I hope when we invite you, you kindly come and share your knowledge with our audience.
Thank you, Doctor. Okay. It takes immense pleasure for me to be in front of you and to share some of the experiences and knowledge that I've acquired over a period of time.
And to our viewers, it's been a pleasure. Thank you for staying tuned. And please check our website at www.basildonsidebyside.org and our YouTube channel as well, Basildon Side by Side, for more of these videos and other health related topics. Thank you and have a good day.